Hi, Mike Gibson, live here from C3 with a good friend of mine, Mehta. Welcome.
Happy to be here, Mike, and good to see you again.
Good to see you again. For years you've run your meeting, Lumen. Tell us about the past, present, and future of Lumen. What's coming up?
Well, Lumen, I became the world's first large subject-centric STEMI meeting, consistent with Dr. Mehta becoming the world's first STEMI interventionalist.
Well, it's kind of the reverse STEMI phenomenon. You go to the patient rather than a patient coming to you. And there was an interesting article published showing that actually can cut down on door-to-balloon time.
It's a wonderful article. I think the Chinese will surprise us in the innovations they bring to this arena. Yet, I don't think that's the final model. The final model is having your own cath lab and driving the cath lab, mobile cath lab, to outside the emergency room and transferring the patient, which I have also heard is being considered. Coming back to Lumen, Lumen has, as Lumen progressed in Miami, it was evident to me that probably the greater arena for my work and for your work, as well as for all of us involved in STEMI interventions, is to expand it and make it international. So February 9th, 10th, 11th, I have created Lumen Global, and the first Lumen Global meeting would be in Dubai, and hopefully it will be a very large international affair. I'm trying to coordinate several countries which are involved in creating population-based STEMI programs, and hopefully will create a very innovative agenda.
How's attendance been?
Attendance at Lumen in Miami averaged between 350 to 400. I think in Dubai it will be at least twice, if not more. I have never believed in creating mega meetings which get a little out of control, yet I think the meeting will dedicate with a formal general sessions, and I think to me the value of having a STEMI meeting is to have numerous workshops which address some very critical areas. Also, I'm planning Lumen Global differently in having three major components which are consistent with how AMI is being managed globally. The first component is thrombolysis, which I think is still a very important issue. The second and the larger area is going to be the pharmaco-invasive management. And the third part, of course, is door-to-balloon interventions, where hopefully we'll teach some tricks.
Well, you know, at large general meetings, you tend to have a broad content, but don't drill down very deeply, but you've taken the opposite approach. There's a very specific topic and drilling down very deeply, but the area of that focus is quite impressive. I
continue to believe, Mike, that this is the real indication for PCI, and I have also made more recent observation, which is deeply troubling. It illustrates the reason some of us need to take our work to the global audience. My demographics of my patient in Miami is a 68-year-old male, and at 3 in the night when I'm rushing into like Kramer and Seinfeld to do the STEMI intervention, you glance around and you see the patient's wife. Sometimes children, sometimes even grandchildren, worried about the fate of their father or husband and grandfather. When you do a STEMI intervention in India, it's the father of the patient waiting outside. The mean age of a patient in parts of Asia Pacific is 35, 40 years old. So a 35-year-old in the midst of all the tremendous economic progress they are making are succumbing to a disease which takes us 10 minutes to open an artery. So to me, the relevance of just about what we are doing not only stays in the US, but I think we need to share it with a much bigger, broader audience.
We've exported metabolic disease to these countries, haven't we?
We have done it in a terrible way, and I also understand I can, 4,000 to 5,000 years of tranquility, peace and yoga and harmony in India has been genetically overwhelmed by the influence of traffic, dual cell phones, that's how people are operating these days, the westernized diet, the tremendous stress, and it's sad. Very little you and I can do about it, but certainly we can educate our friends and colleagues as to how they can apply the lessons of STEMI management much better. And particularly I'm very convinced that countries such as India and China will teach us how to pragmatically apply pharmaco-invasive treatment, which has to be the final answer. The final answer, the rest of the world is the poorer country, the vastly populated countries are nowhere ready for door-to-balloon interventions, but they will certainly use pharmaco-invasive management. There's a very large pool, as you know, of incredibly talented, committed cardiologists, and I'm looking forward to working with them, and I'm also hoping that you will be a major component of what I'm trying to do.
I'm looking forward to being there and participating as a faculty member and bringing clinical trial results there. Yeah. You also have a book out?
Yeah, the second textbook of STEMI interventions, for which your chapter on Prasugrel was wonderful. I'm told it's been sold in 39 countries from what I heard, but I truly believe it's a sincere attempt to make a inclusive textbook with a large amount of illustrated cases. There is a chapter of about 273 pages with 100 illustrated cases. A very compulsive management of thrombus, the various strategies, and chapters by experts such as you and various others. I think it's a very comprehensive textbook, which I hope that practitioners of STEMI interventions will find it useful.
Congratulations on Lumen. Look forward to joining you in Dubai. Thanks for joining us today, and thanks for joining us out there from Clinical Trial Results here at C3.
Thank you.
Thank you.